Welcome to my channel. In the last 3 months of pregnancy, especially after 36 weeks, a pregnant woman's body begins to prepare for delivery. During pregnancy, concern and fears about delivery often occupy the mind of the pregnant mother, especially as she approaches the delivery date. Among various delivery methods, a significant amount of fear is associated with episiotomy delivery. In today's video, I will discuss about what is an episiotomy delivery, when is an episiotomy delivery necessary, which is better, episiotomy or C-section delivery, what are the advantages and disadvantages of episiotomy delivery, answer to some common questions related to episiotomy delivery. So let's get started. Before that, it's important to understand two primary types of delivery: normal delivery and cesarean delivery. Typically, delivery occurs between 38 to 42 weeks of pregnancy. There are two main methods of delivery. Number 1, cesarean delivery. Cesarean delivery, commonly known as C-section, involves delivering the baby through an incision made in the abdomen through surgery. This method is employed when a normal delivery is deemed medically risky or not possible. Number 2, normal delivery. Normal delivery is a natural process where the baby is born through the vaginal canal or birth canal without the use of any surgical instrument or method. Now let's go to our main discussion. What is an episiotomy delivery? Normal delivery is a natural process that occurs through the vaginal canal. The anus is situated just below the vagina. The area between the vagina and the anus is called perineum. To make the process of normal delivery easier and faster, the perineum is often cut. In medical terms, the process of cutting the perineum is called episiotomy. When is an episiotomy performed? Generally, not all normal deliveries require an episiotomy. The decision to perform an episiotomy is not predetermined in all normal deliveries. When labor pains wings and decision to perform an episiotomy is made instantly in certain situations. The purpose of an episiotomy is to enlarge the opening of the birth canal so that the baby can deliver more easily. Some reasons for performing an episiotomy during delivery include: number 1, if during delivery the baby's head is large in comparison to the mother vaginal opening and the baby's head is exerting pressure in the way that may cause perineum to tear, then an episiotomy is necessary. Episiotomy is necessary especially in the case of primary gravidia. Number 2, during delivery the baby's head comes first. But if during delivery the baby's head does not come first and buttocks or shoulder come first, then episiotomy delivery is necessary. Number 3, if there is any condition with the babies and threatened oxygen supply or fetal distress, immediate delivery is required. In such case, an episiotomy may perform promptly. Number 4, if the baby is significantly large in the comparison. Number 5, if there is a concern that perineum may tear during delivery. Number 6, if any medical instruments are needed for delivery, then an episiotomy may be necessary. Therefore, it can be understood that an episiotomy is not necessary in normal deliveries without any specific concern. Is an episiotomy better than cesarean section? Many people fear an episiotomy delivery. If doctors recommended an episiotomy just before normal delivery, pregnant mothers say, "I don't need an episiotomy, perform a cesarean delivery." This raises the question, is an episiotomy better than cesarean section? A cesarean section is a major operation where anesthesia is administered and abdomen is cut through the 5 to 7 layers involving stitching. There is a higher risk of bleeding. It takes time to recovery after the operation. On the other hand, an episiotomy can be performed within 5 to 10 minutes and the mother can return home as soon after. There is no difficulties in carrying the baby. Overall, from all perspectives, an episiotomy is better than cesarean section. What are the advantages and disadvantages of episiotomy delivery? Now let's discuss first advantage of episiotomy. Number 1. Prevention of perineal tear. One significant advantage of episiotomy is that it is helped prevent tearing of the perineum during childbirth. If the perineum tears during delivery, the pathway between the anus and vaginal canal can merge, leading to severe complication, and episiotomy can minimize these risks. Number 2. Quick resolution of fetal head obstruction. In case where the baby's head is obstructed for the extended period of time during delivery, there is a risk of head trauma and other complications. Performing an episiotomy allows for a quick resolution for this problem, preventing potential injuries to the baby's head. Number 3. Faster delivery. Compared to cesarean section, an episiotomy is quicker and involves less complexity. This results in a shorter recovery time for the mother, and she can resume normal activities sooner. 4. Compared to a cesarean section, an episiotomy is often less risky, the cost is lower and recovery is faster. Let's talk the disadvantages of episiotomy. There is a risk of infection at the cut site. However, any kind of surgery, the risk of infection exists. Number 2. Scarring may occur at the cut site. However, currently cosmetic stretching is done, making it difficult to notice the scar. Discomfort during sexual intercourse is common, especially for many mothers after delivery. This gradually improves and patience is necessary in such case. Now let's discuss post-episiotomy care. The most crucial aspect after episiotomy is taking care of the cut site. After episiotomy, it is essential to take special care of the cut area because it is most susceptible to infection due to the proximity of the anus. There are some guidelines. Number 1. According to medical advice, antibiotic may need to be taken and antibiotic ointment should be applied. Number 2. If there is pain, you can use pain relief medication. Number 3. After urination, ensure to keep the episiotomy site clean. It is recommended to use water from the front to back during cleaning. Number 4. After 2 to 3 days, you can give a warm soak to the episiotomy site. Take warm bath. A bathtub with warm water and submarining your genital area in the water. It is promote healing, can offer temporary pain relief. Number 5. In case of constipation, it is necessary to take medication that soften stool at laxative to keep the bowel movement regular. Number 6. After delivery, there might be vaginal bleeding, so it is important to regular change sanitary pad. Do not use same pad for extended period of time. Answering your question. Number 1. Does having intercourse cause problem after episiotomy? Answer. Many people believe that after episiotomy the genitalia become loose and husband feel uncomfortable during sexual intercourse. This is completely a misconception. After episiotomy, carefully stitching is done and there is no risk the genitalia become loose. Generally, intercourse can be resumed after 45 days of delivery. By this time, the episiotomy won't heal and there should be no issue during sexual intercourse after the 45 days of period. Number 2. Once an episiotomy occurs, does it need to be cut again and again? There is also a misconception. I have already mentioned that episiotomy requires special consideration. So, if there is no necessity during the delivery time, there is no problem with delivering without episiotomy. Number 3. Do you need to stitch off after the episiotomy? Currently, there are many advanced silk that, when used for sewing, eliminate the need for cutting. Sewing happens automatically with this silk. In the past, some older people used to deliver normally at home and they were not skilled in sewing. Due to the pressure of delivery, sometimes perineal tear would occur even though they were not skilled in sewing. Various problems were observed later. From there, fear of episiotomy delivery has been created in the mind of people around us after hearing about the repeatedly. Before concluding, let me provide an example. When a tailor cuts off a piece of fabric and sews it, a beautiful dress is created. However, the same piece of fabric is torn and then attempt to be sewn, it may not be suitable for sewing. Episiotomy delivery is essential, a process that, according to well thought out plan, minimizes complication. I hope we understand. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.